Production funding for Behind the Headlines is made possible in part by the WKNO Production Fund, the WKNO Endowment Fund, and by viewers like you. Thank you.
Mental health and the criminal justice system, tonight on Behind the Headlines. I'm Eric Barnes with the Daily Memphian. Thanks for joining us. I am joined tonight by Lori Powell, CEO of Alliance Health Systems. Thanks for being here.
Thanks for having me.
Frankie Dakin is Deputy Chief of Staff for the Shelby County Government. Thanks for being here.
Thanks for having me.
Miska Clay Bibbs, apologies, is Chairwoman of the Shelby County Commission. Thanks for being here again.
Thank you for having me.
And Julia Baker covers criminal justice and public safety for us at the Daily Memphian. We're talking about the mental health, the criminal justice system. We've talked a lot about crime, public safety, criminal justice over the last year and a half. Also about how crime, the first quarter stats are coming down and all the kind of various efforts to work on crime. We probably, to a fault, haven't done enough on mental health. And I think, Frankie, I think you reached out to us about some of the things going on. We've certainly written about it at the Daily Memphian, but to get you all on to talk about some of these initiatives. And I think probably I should start with the chairwoman here and just talk about what's going on now in terms of the investment in juvenile mental health and a new facility up on Broad, but also separate but related, and I mean thematically, in terms of mental health at the jail.
So I think I just want to start off the conversation by saying that I think you have a group of commissioners that are willing and honestly able at this point in time to make these investments based upon the fact that we're using ARPA dollars because we have to spend them down by the deadline. You have a group of commissioners that really believe in the fact that mental health is an issue. There is not a community meeting that probably all 13 of us have not attended in our communities where that's not the number one thing that people talk about. So the outright investment that we're doing out the gate is being able to build a building in order to start a new program, which with the help of Mr. Dakin in the government side, the administration side, we've been able to move this forward. And that to me is a huge win because not only are we building a facility, we're starting a new program that we know that's going to change the lives of our citizens.
And the one that opens in January is the juvenile, is for juveniles, is that correct? Or are you talking about the one for and I'm going to screw this up a bunch, but I want to but I want to make sure everybody understands that it's not one effort. There's just overlap because it's county, because it's and so on. So
it's multiple efforts. So the one that I'm really talking about is the effort that we're doing that we're starting from scratch. We're building from scratch. We're modeling after what they did in Nashville, Davidson County around how they treat mental health when you are in the justice system in order for us to be able to stop the cycle. So that is what these dollars are going for, which was a pretty big win for us.
Yeah. Frankie, you reached out and this commitment from the administration point of view came about why?
Yeah. So 201 Poplar has been the largest provider of mental health care in our region for decades, and virtually everyone agrees that shouldn't be where mental health care issues are handled. Alliance and Lori's team does a great job and has done a great job in diverting individuals pre-arrest to Alliance Healthcare Services so that we can not clog up 201 Poplar and make sure people that don't pose a risk to community are getting mental health care. However, what the chairwoman is leading on is a brand new reform which individuals booked into 201 Poplar within 24 to 48 hours would receive timely referral to a new mental health care facility that's ran by Shelby County government. So I've been very encouraged by the outpouring of support. Like I said, virtually everyone's for it. The district attorney, the sheriff is led on this, and the community, of course, wants to see it.
Let me bring you in. Alliance Healthcare provides services where, when, and how?
Well, throughout Shelby County, so we have 18 different locations, outpatient housing, and the largest crisis system in the state, maybe in the country. So the building on Broad you're mentioning, that's our 55,000 square foot facility that we're building. Right now we divert 400 people a month that are brought in by CIT police or the sheriff, and we'll be able to divert even more and get them into immediate treatment. And that's our mission.
CIT stands for?
Crisis Intervention Treatment Team. Crisis Intervention Team, and it was founded here in Memphis, where they learn how to de-escalate people who are experiencing mental health crisis, and it was founded here, and now it's an international model.
Let me bring in Julia Baker.
Freak, I want to go to you. A lot of this, the pretrial behavioral care center is based off of Nashville's mental health facility. What will be included in the Memphis model? How will it differ from the Nashville? I know you mentioned it's going to be bigger and more outdoor space. So kind of go into that.
Yeah, so we have the benefit of learning from Nashville. So I'll say that we're lucky. There's only a couple of jurisdictions across the country that's really doing this mental health safety and justice center model. Luckily, Nashville is one. So they've been in operation for 2 or 3 years. What we've heard from them is absolutely access to outdoor space. We've also heard that we need more and housing types in this facility. So for example, Nashville has 2 pods, one for women and one for men. So we are planning to build 4 pods. That way, if somebody's coming in and they may have a more acute mental health issue or still detoxing, they might not be able to participate in the group therapy and so forth that other people can participate. So we'll have additional pods to be able to treat people in the way that they need to be treated.
Ms. Powell, so, kind of go into, while, the mental health facility would be, after somebody's arrested, you're really trying to get to people before they're arrested.
Right, and we started the 2 co-response models. One is called the CARE Team, Crisis Assessment and Response to Emergencies. That's with the CIT and the fire department. And so we go out into the community and bring them to that level of care that they need. And the goal really is immediate treatment, immediate access to care, and diversion from long waiting in the ER or incarceration, because there's so many people with misdemeanors who do not need to be incarcerated. And so we will be gearing up and have more space to do even more of that. And then the co-response model with the sheriff is called SAFE. Let's see, that acronym stands for Shelby Alliance Access. Anyway.
I don't do acronyms either.
I'm sorry.
No, it's okay.
But it's the same kind of thing where they're going out in the community. And so I think we're building something unique here. We work really closely with the sheriff and the city government. I think we're passionate. I think we're finally doing something that's really needed to be done for a long time. And I always wondered why Memphis didn't have that same facility that Nashville has. And so that's just another piece to the continuum of care that we need to develop.
Do you get pushback from constituents or from just people in Shelby County who say, yeah, but we're treating people softly who need to go to jail? Is there that this person committed a crime and what they need is to go to jail? They need more of a punishment. Do you hear that from constituents?
Yeah, you absolutely hear that from constituents. But I think the reality of it is we have to look at it beyond that point, because if you see repeat offenders, and absolutely it's a deeper problem, hopefully just the continuum of care will try to stop some of that. And I think you have a group of commissioners that really believe that we can do something better and different in Shelby County.
What level of offense are we talking about here? I mean, where you would have a diversion. I'm not sure who that's.
Well,
I would
let me
assume.
give you some examples,
yeah,
okay?
Please.
Somebody that's running down the street naked, they might be scaring people. They'll say that might be disturbing the peace. Someone who's intoxicated that needs to be in our public detox facility, which is part of that whole continuum. So we have 45 beds that do different things. Medical detox, if you need to get off opiates, alcohol, crisis stabilization unit for the mental health emergency piece. And then it's kind of like an emergency psychiatric room where we triage them, find out the level of care they need, and get them that immediate care. So another story that I heard about was somebody that stole a barbecue sandwich because he thought he owned the barbecue store there on Bill Street or something. And the owner pressed charges. That person ended up at 201 Poplar, and I'd really like to see less of that because we could have gotten him diverted. But it depends on, does the person want to press charges? I mean, that person does have a right to do that.
Yeah.
But that could be somebody that we could divert.
And I assume there's a point at which a violent offense does or does not go into
Right.
this
Yes.
kind
If
of
somebody just stabs someone, they're not going to bring them to us. The police will bring them to 201 Poplar.
Right, right. There's people talk maybe not enough about how expensive the jail is, right? To jail someone, I mean, as a country, the prison system is hugely expensive. To jail someone, one of the reasons that Governor Bill Lee was resistant to doing the expansion of mandatory minimum sentences last year, and then they got expanded, I think, this year on certain types of offenses, was partly the cost. I think he had other reasons, but it's just very costly. Is this? Again, we're taking out the violent offenses. We're not talking about that, just so people know. But for the kind of offenses that Lori talked about, is it a more cost-effective way that you look at it?
100%. This is going to save taxpayer dollars down the road. Now, we have to make this significant investment in the facility up front, and the chairwoman's already rightfully pointed out that we're using federal funds to do that. But right now, you have individuals that are booked into 201, sometimes even on a misdemeanor, that are remaining there for over 100 days, 200 days, 300 days. So what we're looking is diverting those individuals who we all agree pose no risk to the community to health care for up to 30 days. So while the treatment may cost upwards of 3 times as much when they're in that healthcare treatment, we're reducing the number of days that taxpayers are paying. And it costs us $100 a day to house somebody at 201 when they're in their right mind.
Yeah.
If an individual is having a lot of issues and needs additional health care in 201, it costs quite a bit more.
Yeah, Julie.
So I was, in a bond hearing for a defendant recently who, a mental health professional testified that, mental health services in the jail often aren't sufficient. How will, the new mental health treatment that they get in this facility compare?
Yeah. So I think that's a great question. So I'm sure you've toured 201 and you saw that is not a place that anybody in crisis needs to be. And by the way, all of these individuals are going to come back into the community. So after you spend 100 days at 201 Poplar, if you came in crisis, you're not leaving better positioned for success and better positioned to be a meaningful participant to our community. And a lot of that has to do with the space. And so what we're looking at with this news facility is treatment first. So there will be spaces for group therapy, there'll be spaces for individual therapy. Everybody coming in will have a plan for care while they're in the facility. They'll also have a plan for continuation of care as they leave the facility, working hand in hand with organizations like Alliance. So that's a huge difference than what happens at 201. I'll also say that for those individuals that may not be a good a case for diversion, post-arrest diversion, it frees up space within the jail right now, because the individuals we're talking about at the Mental Health Safety and Justice Center that would be treated there are in the jail right now.
Right.
So when you take those individuals out, you can focus your efforts on others.
Yeah. I think it's something like 2/3 of detainees have mental health issues. So, other than the fact that it's a misdemeanor versus felony, like how do you determine who gets in there, who's involved in that process?
That's a great question. So Nashville has a really collaborative model. So 5 days a week, the public defender, the district attorney, representative from the sheriff, and mental health professionals meet in a room and they look at potential transfers to their behavioral care center. We plan to adopt that same collaborative model. The other piece of this is that it's voluntary. So you have to choose. Some people may choose to remain at 201 and do whatever time that they go to trial or whatnot. Most people, we believe, want treatment, and most people, we believe, will come and receive treatment at the facility.
I'll go to you on this, Lori. The staffing. I mean, there's been huge challenges. I had Reginald Coopwood, the CEO of Regional 1, on a couple weeks ago, just talking about the challenges of staffing. For him, for Regional 1, he said it's calmed down post-COVID, where everyone's really struggling. But in terms of staffing and getting qualified mental health folks into the facilities, how hard is that?
We've had to definitely raise our salary scales. Registered nurses are, really hard to come by, so we had to increase our sign-on bonuses. And the Department of Mental Health did give some of the nonprofits like Alliance some funding to retain and recruit licensed staff, licensed therapists. We have 120 staff right now just at that one location, the 24-hour hub for crisis. So 7 days a week, 24 hours, RNs on every shift, therapists, nurse practitioners, psychiatrists. It's a huge operation.
And
yeah.
that's for give or take, the capacity in terms of patients is what?
That's right. We see 15,000 a year at Alliance. I think the second largest crisis is around 8,000 in Nashville. So that's how many we're seeing.
Back to you, Chairwoman. Frankie mentioned this, that it takes this collaboration. And I think I always say, maybe too much, but I think it's really important when we talk about the criminal justice system that it is all these different islands. Sheriff is independent of the DA, is independent of the judges, is independent of MPD, is independent of the county commission and of the city council, let alone the state, and most of the laws and are set up there. You've got the judicial commissioners under the judges. On this issue, you talked about the commission being really very much in lockstep in making this a priority. What about conversations with these other entities? Do you see buy-in, the kind of buy-in that Frankie was talking about?
Great question. I think the reality of it is we have, it's the adults in the room, and if the adults have to make sure if they want to move these issues forward, we got to start talking with each other more. I think we're trying to lead by example. This is one of the first times that I have been as an elected for the past 10 years that I've been able to say, hey, I'm working in concert with the Shelby County administration. We're trying to model, because also when we're in commission meetings, we ask for data sharing. We're asking for coming to have more meetings around everyone coming together. So far, so good, but we are definitely living in a county where there are a lot of silos. And quite honestly, these silos have not been serving us well. I'm thankful that at least for the really big issues, administration and the county commissioners are able to work together. When we bring the sheriff to the table, he shows up. There are some other things I think that we're probably have to work better on, but the reality of it is I think the modeling that we're doing is people are showing up when we ask.
Let me bring in another part of this, which is there's been a lot of talk about does the county need a new jail? The 201 Poplar is a very old facility even right now, and again, as we're taping this a week before it airs because of my schedule, so some of this may have changed a bit, but the gist is right now there's 100 cells in 201 Poplar that don't have locks, and so you're having to pay guards to guard those cells because they're, I mean, sort of some of the basics of criminal of jailing. I mean, so, but is there the money and the will and the interest to put what would be at least $1 billion, I think people have said, to build a proper new jail facility, or is that just down the road?
Hey, that's a really great question. As we, enter into the budget cycle, the reality of it is there's no question we do need something different for 201 Poplar, the jail system. We have to do something different, but then it's the dollar and cents of it. It's how do you say you need to build schools, need to build a new public health hospital, which is Regional 1. We're already stepping out on that, and at the same time saying you need to build a new jail. Really having real strong conversations around how to pay for that. That is not an easy conversation. That involves taxpayers having to weigh in on that conversation because it's their dollars being used. And there are a lot of proposals that are out there, but the reality of it is, how do you make all of these things happen at the same time and get taxpayer buy-in?
Before I go to Julia, let me go back to you, Frankie. Mayor Harris did not put a new jail facility in the budget, did put schools in, a huge commitment to Regional 1 and its big expansion and so on. But where, if you can speak for the administration in terms of the priority of a new jail facility?
Yeah. So recently we worked with Commissioner Wright and others to bring a resolution to study a new jail facility. So we put aside $250,000 to study a new jail facility. As you mentioned, best estimates that I've heard, over $1 billion. We need to have a sustained conversation in our community. We need to have the data available for commissioners to make a good decision on this. And I'll also say the Mental Health Safety and Justice Center is an expansion of our jail's capabilities. Just because it's not located on the same site doesn't mean it's not a part of the jail. Keep coming back to Nashville and Davidson County. When they built their new jail facility, the sheriff decided to cut off, I think, the 5th floor and build the behavioral care center. It's a part of that facility. So we are expanding the jail's capabilities right now.
So I think the mental health facility is going to be near off Mullen Stations, and I know Sheriff Bonner mentioned that he was looking at that area for the jail. Would that still be able to go over there, or would you guys have to look at a new spot for the new jail?
Yeah, Julia, that's a great question. I think that's why we put aside this money to study, because there are multiple sites that it could be. But yeah, absolutely. So the Shelby County government owns quite a bit of land out off of Mullins Station that's already used in a corrections capacity now. Jail East is located out there, so that's definitely part of it. I'll also say that's one way that we were able to bring down the cost of the Mental Health, Safety, and Justice Center, by using county-owned land instead of going out and acquiring privately owned land.
I want to ask each of you, Ms. Powell and Mr. Dakin, how many beds would each of these facilities have?
Yeah. So for the Mental Health, Safety, and Justice Center right now, and we're finalizing an architect and so forth, so this may change, but we're at 64 beds. 64 beds.
Right. And with the new Alliance Wellness Center, that will be 45 beds. We have 27 beds right now, but I do want to add, we're talking about adults right now, but we were funded for the Children's Crisis Stabilization Unit, and I really want us to be able to divert even more people from criminal justice that are, we're going to treat 4 to 17, and it's going to be on that same campus. So we will start building that right after we open the facility in February. So that will be our entire wellness campus. We have to do more for children and youth, and that will have a walk-in center, co-response models working to divert from emergency rooms, and we need to do more of that. There's one facility like that in the state, and that's in Knoxville. So we will immediately begin construction on that.
I imagine some people got hung when you just said 4 years old.
Yeah.
How I mean, that is with parent, without guardian.
Yeah.
That kind of situation is kind of horrifying to think about.
I mean, we can have, a whole show about the need for children and youth and diverting into treatment and educating the community around trauma. I mean, you'll hear Caswell. I'm sure you've heard him talk about trauma. Our community's in trauma, right? And so we have expanded children and youth programs in the school. We just need to do that entire continuum for children like we've done for adults, and prevent them from having to go to 201 Poplar. If we can address that trauma early on, get them into treatment, they might be in DCS custody. Kids need to be assessed and then immediately referred to a level of treatment. And that might involve DCS, it might involve the guardian, family member. We just have to do what we can to help those kids.
With a few minutes left here, I'll come back to you, Chairwoman. We have a new, after a long search and a long journey, we have a new superintendent of schools. One, I just want your general impression of her, that you all don't have necessarily direct control of the school system, but you are the funder. I mean, so you have a lot of control over the school system. They have their separate board, which you used to be on years ago. And this issue of mental health and these interventions in the school system, lots of people talk about that. That's a place where, boy, can we intervene there when kids are truant, when they're having trouble at home, none of their own making. Your thoughts from, she's got the new superintendent has a big bunch of challenges, but your thoughts on this specific issues and her.
Oh, absolutely. So I am a member of her transition team, so I definitely want to put that out there, because I absolutely believe in our school system being the place where people go to for all things, everything. So that's why the mental health portion of it is so important. I think she's fully aware around what she's stepping into in our community, and I think she's up to the task. The reality of it is, I think it's about coming back in and all partners working together and everyone being on the same page again. Because every time there's a change in administration, you have to start that conversation all over again. It's clear that in Shelby County, between trauma and just mental health and ACEs, is something that we have to think about every day. When I was a school board member, we voted on becoming a trauma-informed school system. So that work is still happening. That's something that I've brought up in my conversations with Dr. Fagans, and I know that she still believes in that work. So the reality of it is, I don't think this is a stopping point. This is more around, where do we pick up from where we left off?
Can I add to that
Yes,
just real
please.
quickly? So the governor has expanded school-based behavioral health liaisons. That's a master's level licensed clinician. Alliance has 15 of those. But if the budget goes forward, the goal is to have one in every single school. And we're having monthly meetings with the mental health in the school system. They have a mental health unit in the school to make sure we're all working together. That's UT, University of Memphis, Alliance, Urban Child Institute. All of us working together to make sure we're closing those gaps, and every school has what they need to address the mental health issues.
Let me come back to you again, because your relationship to the school system, and apologies to Frankie and Julia with a minute left here. Truancy. We just did story on truancy. Truancy is a national problem. It is across the country. New York Times has done, others have done big stories on it. And it's not just a Memphis Shelby County schools problem. All the suburban schools, DeSoto County, have huge truancy. It exploded during COVID and it hasn't really come back. Your conversations with Dr. Fagans, who we're trying to get on the show as soon as we can, about truancy, because you can't, not only can you not learn, for a lot of kids you don't eat.
Correct.
They're not going to have these kind of trauma interventions and the mental health services that you all are talking about if they're not at school. And so what do you think can be done there?
I don't want to speak for our brand new superintendent.
Fair enough. But you're really versed in this stuff.
But I do know that she has a plan. Like yesterday, it was our first transition team meeting. There was a plan, or the beginning of a plan that we discussed. The reality is it's going to be all hands on deck when it comes to truancy. As a commission, we actually gave additional dollars to our juvenile court judge and the clerk around how do we look at truancy. And we're hoping that some of those human capacity is being built around how do we look at truancy in our community. And if everyone's working together, then we can kind of change it. One thing I want to note, it is a national issue. But what we learned yesterday was Memphis Shelby County Schools was not at the top of the chain. We're actually doing really well versus a lot of the larger cities.
And our data showed that as well. So thank you all. Sorry to cut you off at the end there on a really important issue. Thank you all for being here. That is all the time we have this week. If you missed any of the show, go to WKNO.org or YouTube to get the full episode, or download the podcast of the show wherever you get your podcasts. Thanks very much, and we'll see you next week.